My name is Keith Javery, and I'm the president and medical director of Javery Pain Institute.
I would describe Javery Pain Institute as innovative, moving forward.
I say cutting edge because anything new and upcoming, he's always on the edge of that and looking forward to see, what's next for the practice. I know they're never looking at staying where they're at. They're always looking at growing.
I would say sign up because this is a really good place to work for.
The actual name Javery Pain Institute was actually my wife's idea. And at that time I was a senior partner with another pain clinic in town, and I'd been in town for 15 years. I talked it over with my wife and we went back and forth, and she and I really wanted to do this, to open up something in the community that perhaps offered something not just different, but what we felt was both different and maybe something better in a sense.
I started with Dr. Javery 21 years ago, and Dr. Javery opened up the Javery Pain Institute in August of 2009. I just thought that I, got along with Dr. Javery, and it was very nice of him to ask me to come along. And at that time it was a small practice. Obviously we have grown quite a bit in the last, 7 years. He said it was going to stay small, but
The question as to what would make, or who would make, a great JPI physician. I think it's got to be someone, in my opinion, it's got to be someone, first of all, who has empathy. I don't care if their hobby is this or that. I don't care if they've operated on tens of thousands of people or just fresh out of training. I care first and foremost about empathy. I want someone who cares about themselves, and I want someone who cares about other people other than just themselves. That's a rare mix to find both. But they're out there, and I think we got them, but we need more.
I think as a whole, JPI's mission is get your life back. And so that implies that we're really looking at your function. We're looking at how we can help to manage your pain so that you get your life, get your function back. And we may not always get people a 0 out of 10 pain score for 12 straight weeks, but every time we're going to try our hardest, and I think we do pretty much all the time, help people to function better with less pain and allow them to live a more full life. And that's what we focus on with every visit. When we go into the room, it's how are we doing on those levels? How can we do better? And we don't always hit a home run, but that's certainly what we strive for from the function standpoint, helping people to get their life back and do things that they once enjoyed but were limited in doing because of their pain.
I think it's easier for me to process because I deal with my own pain. When I came to Javery, I didn't even put the two and two together. I'm having a back surgery, having rheumatoid arthritis, but when I started listening to the patients, I started realizing, man, this sounds a lot like me. And then I really started to relate to them. So when I listen to their story, I get a sense of, this person has really been dealing with this for a long time, and people around them don't understand what they're going through. Their support system is there, but they're not going through that. The patient is going through this. And it's like an invisible pain. So when other people listen to them, daily, they say, oh, I hurt, I can't go to work, or hon, I can't go to the mall. That's just normal for them to hear that, but it's really a real thing that they're dealing with, and it's a struggle. The rewards are good, when you see a patient getting benefit from what we do. So that's very satisfying. So I say if you want, really help people and you care about people, come here, come work for us.
Since we opened JPI, it was just myself and 5 or 6 other people. This was opened in August of 2009. And we are now one of the largest, if not the largest, single location pain clinic, certainly in the Grand Rapids, West Michigan area, if not in the state and beyond. You want to come here because not only will you have a fruitful career, but you'll have a rewarding career, both from a great relationship with patients, with a rewarding career as far as colleagues, respect, financially, all of this. And plus Grand Rapids is, I consider it, I'm from Florida, I'm from South Florida, and Grand Rapids is the best kept secret. Because I did not even know I didn't know where Grand Rapids was when I first came here. In fact, I remember arguing with some other physicians in Kentucky. Oh yeah, no, it's over here, it's over here, no, it's over here. And I looked at it on the map and I never looked back. And so they'll get to enjoy one of the best places to live and raise a family and be involved with a practice that has grown like no one thought we would grow.